Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the lines of healthcare. I'm your host, Dr. Emmy Nylander, and I'm thrilled to be here with you. Whether you're a healthcare professional, someone passionate about wellness, or someone who's looking to gain more knowledge about your own health and well being, you'll find stories here that resonate, educate, and inspire. This podcast was born from a shared truth. Healing isn't just about medicine, it's about connection, listening, and leadership. And who better to lead that conversation than women physicians? This information on Healing with Her is introduced for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by the hosts and guests are their own and do not necessarily reflect those of their institutions or employers. So, good evening. I'd like to introduce you to Dr. Pam Reed and Dr. Kimberly Wooten. Kimberly Wooten is our guest today, and this is in honor of Head and Neck Cancer Month, which was in April, but she's here today to talk about. So, what is head and neck cancer, Dr. Wooten?
Thank you so much for having me. So you're right. In honor of Head and Neck Cancer Awareness Month, I think head and neck cancer needs to be highlighted. We're a couple weeks late, but that's okay. So head and neck cancer is any type of cancer that we describe as being in the aerodigestive tract. So there's four pockets of that I always think about when I tell people about head and neck cancer. One is the mouth, which is oral cancer. One is the throat, which is essentially the tissue behind the mouth. So the mouth goes from the lips and the teeth to the uvula, which is the dangly thing that hangs in the back of your throat. And the tonsils would incorporate and the oropharynx, which is the throat, the nasopharynx, which is essentially the tissue behind the nose and that space behind the nose. And then last but not least, the voice box.
Very good. Why is it important that we talk about head and neck cancers?
Yeah, I think that's a good question, particularly because it does affect our community a little bit differently than other communities. But it's a cancer that is comprises about 2 to 4% of all cancer diagnosis in the United States. And so that means about 70,000 people will be diagnosed this year, and unfortunately 16,000 will lose their lives to head and neck cancer. And it's one of the cancers that unfortunately we don't talk about a whole lot. It's not as publicized as breast cancer or prostate cancer, and it's unclear as to why that difference other than the fact that historically head and neck cancer was associated with vices that we deemed kind of were causative. So smokers, drinkers. And I think because of that, we just don't have the same support from the medical community or the community at large.
What are the different types and major risk factors for head and neck cancers that you see?
Yeah, so I think that's a very important question. Also, mostly because now there's been a huge shift in the types of head and neck cancers that we see. So, like I mentioned before, the four major types are going to be based on the spaces or the subtypes. So, the mouth would be oral cavity, oral pharynx is the throat, the voice box is the also would be considered throat cancer, and then the nose would be the nasopharynx. And those are the major four types. But the most common type of head and neck cancer that I tend to see tends to be the mouth, the throat, and then the voice box. So when we're talking about some of the risk factors that are associated with it, smoking, drinking, chewing tobacco, those are probably the big three when it comes to developing those types of cancers. And it's mostly because they expose the lining of the mouth and the throat with all sorts of poisons. We call them carcinogens, which are cancer causing agents that can change that tissue. And then eventually a cancer can develop there.
So you named those causes, and I'm just wondering, are there any other environmental causes? So from an I'm thinking occupational standpoint,
Mhm.
exposure to toxins that you're breathing, and I know usually that's the lung, but I was just wondering if any of those, if there's any environmental toxins that affect.
Yeah, absolutely, especially when we're talking about the nasopharyngeal cancers, environmental diseases, especially like chemicals, can certainly cause changes to that tissue and can result in disease down the line. Vaping has also been identified as something that we are associating with some head and neck cancers. The information is really early because we don't have a whole lot of data on vaping, but we do know that it does put people at higher risk for cancers of the head and neck, especially if they were non smokers and non drinkers before. Um, and even though we oftentimes will say vaping is safer than smoking, um, it's wouldn't necessarily say that it's safer. It definitely has its own form of carcinogens or things that cause cancer. Formaldehydes in the vaping products, heavy metals are in the vaping products, so all of those can cause cancers as well. So I would consider that also environmental, secondhand smoke. Um, some of the in Buffalo especially, we have a lot of industry and a lot of production, at least historically, and I think that that can be associated with all forms of disease in the aerodigestive tract as well.
Right. And another question that
Mhm.
just came to mind. You said tobacco. What about marijuana? Inhaling marijuana.
So that's a great question, and so some of the information on marijuana, we're not quite sure because it generally, when the marijuana is packaged, there's less of those carcinogens in them.
Okay.
But it still is a form of smoking. And so smoking itself is going to have those particles. There might be some heavy metals in them as well. So I think smoking in general is certainly a causative agent. It's really hard to pinpoint with regard to marijuana just because it's packaged a little bit differently.
Okay.
So, with vaping being more prevalent in younger
Mm.
generation, are you seeing more head and neck cancers in young people?
So that's a great question. I don't think that we have seen as much as maybe we would expect, but I think vaping has only been around for a handful of years. So I think that we'd have to wait some more time to get some of that data.
What are some things that we can do to help prevent, or decrease our risk? Obviously, stopping smoking. Are there any
Absolutely.
vaccines out there available?
Absolutely. So the most common, at least the patients that I see, about 60 to 70% of my patients now are actually patients that are non-smokers, non-drinkers.
Mm.
And these are patients who have been exposed to the human papillomavirus, which we've all been exposed to. Um, but most of us are able to clear the virus from our body. And about 1% of those patients, unfortunately, can't clear the virus, and then it can turn into a cancer. For women, we typically will get cervical pap smears and evaluations that way. But we don't have a standardized test for head and neck cancers per se. But the exposure to HPV and particular certain subtypes of HPV is a known risk factor, and it's something that is much more prevalent now than it has been in previous years. So I would advocate for vaccination with Gardasil, which we can get up until age 45. It's FDA approved until age 45. And it does protect against the most common strands that cause head and neck cancers, but also vulvar cancers, anal cancers, um, and cervical cancers as well.
So two questions come to mind as you say that. So for Gardasil, what's the youngest age?
Yeah. The youngest age is 9. So that's when they start the vaccination protocol. So 9, 11, 13. That's the typical cohort of children who will get that vaccination. But they will extend that vaccination up to age 45.
And then because the human papillomavirus is associated with cervical cancer, is there any correlation between those who have cervical cancer due to HPV and those who will have head and neck cancer due to HPV?
I think that's an excellent question. We haven't really seen that in the literature yet.
Okay.
Um, and I think my theory is that the virus tends to localize in one or two subtypes or sub tissues. So if it goes to the cervix, it's not like it's just sitting around in the body waiting to latch on. I think that's the tissue that unfortunately it held on to and it
Okay.
wasn't cleared from.
So, what symptoms can you start to see with that might push you to go see a provider?
Yeah, so we see a lot of patients present with a neck mass. So that's probably the most common symptom that patients present with, and they oftentimes find it themselves.
Mm.
So the typical story will be a man who's shaving and he notices a bump on his neck, or when he's trying to button up his collared shirt, it's tighter around the neck, and then he notices that. Women can sometimes notice when they're washing their face or doing their nighttime routine, and then they feel a bump that they didn't notice before. So a neck mass is probably the first one of the most common symptoms. Other than that, the other symptoms would be based on the location. So if it's in the mouth, if you have any type of lesion in your mouth or your tongue. So typically, if you have a cut on your mouth or a cut on your lip or something like that, it will heal in a matter of 2 to 5 days. So if there's an ulcer or a mass or a bump on your lip or your tongue or your mouth that doesn't heal within 2 weeks, then it definitely should be evaluated. Other symptoms are going to be a sore throat that lasts for a really long time and outside of just being sick or a change in the season or allergies that should be evaluated, or voice changes, specifically hoarseness. So oftentimes, the Bills fans will be screaming at a game and we'll lose our voice for a week. If that happens and your voice never returns to normal, then it's time to be evaluated and seen by somebody.
And how are the patients evaluated? So, what is CT, MRI? What kind of
Yeah, so generally I tell patients to go to their dentist if there's anything in the mouth. So I'll say, okay, go to your dentist first, have them take a look at it. If they feel that needs a biopsy, then they'll send you to a oral surgeon. They'll get a biopsy. And if it's something that say is in your throat or potentially even an ear. So sometimes earache or ear pain or ear infection in an adult is another big red flag. So if you have jaw pain that radiates to the ear or just ear pain, typically adults don't get a lot of ear infections. And if they do get ear infections, they tend to be on both sides. So if it's an ear infection just on one side and it's lasting for a long time and it's not getting better, then see an ENT. And then an ENT, of course, will do a thorough evaluation. So they'll feel your neck, palpate your lymph nodes, or basically just touch your neck and see if there's a mass or tenderness there. They will palpate the back of your throat. So they'll feel the back of the throat and the tongue to see if there's something there. They'll look in the mouth, they'll look in the nose, ears as well. And then they'll use a small camera called um, a laryngoscope, which is a very, very thin, long tube, kind of tube camera. Put in your nose and then look at the back of your throat as well as the airway.
um oral sex? How is that a risk factor?
So I think that's a great question. And so what we know is that the patterns of certain people when they're younger will are definitely associated with who will develop HPV associated head and neck cancers and oftentimes who doesn't. So early oral sex earlier increases the risk of head and neck cancer later on. And it's not something that you get immediately. It's something that kind of sits in your body, just like the chickenpox virus turns into shingles, same type of thought process, hangs out in your body for 15, 20, 30 years, and then pops itself up once it changes the cells and changes the tissue that's there, and that can turn into cancer. But we do notice that a lot of or many sexual partners and oral sexual partners increase that risk as well.
Okay, thank you. How are they treated? Um, I know most cancers you can get chemo, radiation, surgery. If you have a small tumor versus a large tumor.
So generally, the earlier the stage or the earlier it's diagnosed, the better. So that typically means if it's an early stage cancer, meaning that it's in one location. If it's a later stage cancer, that means that it has moved from the initial location, so let's say the mouth or the throat, into the lymph nodes. And if it's an early stage, it's typically treated with one or two ways. One is going to be surgery. So if it's a lesion in the mouth, take a couple lesion out. If it has spread, it would be surgery plus radiation. So Oftentimes, it's surgery or radiation as the first treatment. If it's more advanced, then unfortunately, you're treated with chemotherapy or radiation as a combination. So, generally, if it's an early stage, we try to take it out if possible. Um, if it's in the voice box, then we would avoid surgery unless we can safely preserve the voice, meaning that we don't affect your ability to speak by removing the tumor.
Mhm.
And oftentimes, for early stage voice box cancers, we treat that with radiation as well. Immunotherapy, which is a different type of chemotherapy, has shown lots of effectiveness in head and neck cancer, particularly in head and neck cancer that's more advanced or cancer that has come back in patients.
So, what are some take home points with regards to head and neck cancers that you'd like our audience to know about?
I think the biggest take home points that I tell people is to, if you notice something strange, if you feel that you have a lesion that just isn't going away, you have um, a neck mass, go see your doctor. And I think that's the best way to catch this disease early. I think what's super important within our community is that there's a huge disparity in terms of how patients do when it comes to head and neck cancer. So there are some studies that say that the overall prognosis is, or the survival is 10% less for African American patients compared to their white counterparts. And there are some other studies stating that that number, that difference can be as high as a 75% difference in mortality. So, and of course, not all of the studies show that, but that really means that there's a huge disconnect in terms of getting the diagnosis, getting patients seen, and even doctors having the um, astuteness to identify it and diagnose it early. So I think if you notice something that's different or strange, go to your doctor. If it persists, then continue to advocate for yourself because these statistics are real and patients who don't get access to care have the worst outcomes.
Yeah.
Patients who can't get to a doctor have the worst outcomes. Patients who can't see a specialist have the worst outcomes. And so I think that is a super big take home point for head and neck cancer. It's one of the cancers that we don't talk about a lot. We don't see a whole lot of commercials about it except for the new Gardasil commercial. I think that's the only one I've ever seen about head and neck cancer. Um, and so just understanding that if you feel something abnormal, make sure that somebody checks it out.
Yeah. I know my dad was a dentist, so I'm advocating for, our community, our patients in the community to see their dentist, to go there regularly, because that might be the first person that notices
Mhm.
something that's going on, and can at least get them to the right people in time. But thank you.
Yeah.
Anything else you want to
Yeah.
add?
So, of course, I always have more
I know you
questions,
do.
right?
Yeah, absolutely.
So, two things that I was thinking about when you're talking about the disparity. Is it this is the disparity due to later diagnosis in our community?
Yes, absolutely. So most oftentimes, African American patients are diagnosed at a much later stage.
Yeah.
And so some of that reason, as we mentioned before, can be not getting into a specialist early enough, not getting the symptoms evaluated soon enough, and sometimes just not knowing what symptoms are concerning, especially when it comes to earache or sore throat or voice changes.
Yeah. And then for our audience, just kind of a clarification in terms of like smoking is a risk factor, alcohol is a risk factor. So is the risk factor, we'll start with smoking, actually applies to alcohol as well. Is it related to the quantity of alcohol intake or the number of cigarettes you smoke, or is it related to the length of time that you engage in these behaviors? Or can it happen if you're like smoking for just a short period of time? So, kind of a
Th that's
clarification of
that's a
that.
great point. So, when we look at smoking, we look at something called pack year history. So we look at how many cigarettes did you smoke over X number period of years. And so the number that is the most concerning is a 10 pack year history or greater. So those are the patients who are smoking at least 1 pack a day for 10 years, would be a 10 pack year history, or variations of that that then equal a 10-pack year history. So smoking once or smoking a couple times in your life doesn't increase your risk per se, but it is the frequency and the duration of that exposure. When it comes to alcohol, that's a very interesting question. And I think it's an interesting question because um, what people will admit to is not necessarily consistent with what is actually taken. So sometimes it's really hard to narrow down those numbers. But habitual drinkers, so people who are drinking every day, not necessarily alcoholics who are dependent on it, but people who drink frequently are at a higher risk because they're frequently exposing those tissues to alcohol, which has those cancer-causing agents in it as well. Um, and in terms of the duration, it's similar. So it's if you drink maybe a couple times a year, not as much of an issue. But if it is every day or multiple times a week or a certain volume when you do drink, that becomes a problem as well. Another point that I talk to patients about, especially people who have previously been treated for head and neck cancers, is the use of mouthwash. I know I talked to our dentist, our Dr. Blakely, our guest, about that because mouthwash has alcohol in it and people use that every day. And that's something that, particularly if you have had a lesion in your mouth or if you are a smoker, I would recommend that you maybe back off on the alcohol-based mouthwashes and stick to the natural ones.
Yeah, I think people don't realize that there are mouthwashes that don't have alcohol.
There are.
And so then the other thing I'm going to do is to clarify for the audience, right? You said a pack a day for 10 years. So people should understand that if you smoke a half a pack a day for 20 years, that's the same thing.
That's the same thing. It's the same thing. Yeah.
So you don't say, "Oh, I don't smoke a pack a day, so I'm good." No, if you smoke a half a pack, a day for 20 years, that's the same risk. If you smoke a quarter of a pack that's right. So that's all.
Yep.
That all adds up. And the other thing that my patients would say is, "Oh, I don't drink alcohol." But they drink a case of beer. Well, that is
yeah, beer, and that is the big thing because a lot of people think alcohol is hard liquor. So
Yes.
whiskey, vodka, gin, all that stuff.
right.
But wine counts.
Exactly.
Beer counts.
Exactly.
So all of those alcoholic beverages, moonshine also counts, even though you don't buy it at a store.
right.
That also counts as alcohol. But yeah, I think those are excellent questions to help clarify because that makes a huge difference.
Yes. Yes. Because people will certainly tell you, right?
Absolutely.
And then the other thing, so these things just come to mind. They were called black and whites. Is that what they were called?
The cigarettes?
Yes. What are they
Yeah, well,
called?
Are these menthol cigarettes?
So no, the cigarettes that have a higher content of, or they're cigars or little cigars.
Oh, cigars.
You remember, that was
Yes.
like a fad
Yes,
among
yes,
young
yeah.
people,
Yeah.
maybe a few years ago or maybe a decade ago, where each of them had like the equivalent of like 10 cigarettes. Do you remember what I'm talking about? I'm dating myself now.
I think I remember. They're kind of like short
Yes.
cigarettes, but
yes.
they were thicker. Yeah, cigars are also included in that too. And I think what people forget is because they tend not to smoke cigars as regularly, it's not as big of an issue, but it is still a carcinogen. It still has issues. And on that note, I have to just highlight dip, which is another form of chew.
Yes.
All of those have poison in it, essentially. I don't know how else to call it, disease-causing agents. And for oral cavity cancer, it's really based on where you keep it. So if you keep it under your lip, that's the most exposed in contact tissue. And so that's going to be at the highest risk. If you keep it on the side of your cheek, which is, I think a lot of people put it on the side of their cheek or in the front of their lip, those are the areas that's going to have the most contact. So there's not like a number for dip because we can't say, how much they're putting in there. It's just the frequency of the use is really the issue.
Yeah, and is it more toxic, that actual pocketing, than the smoking of tobacco?
So when we compare them, there definitely is a higher risk of like localized disease because it's constantly causing damage in that area. Whereas smoking creates more of a widespread change in the tissue in the mouth. And that's really what we see with cancer. So there's a concept called field cancerization, which essentially is you have a lot of exposure of, especially your mouth and your throat, to alcohol, smoking, or things that will change the nature of the tissue
Mhm.
and then make them more inflamed and potentially allow changes to occur, which can, over the time of constant exposure to those disease causing and cancer causing agents, can turn into a cancer in multiple areas in the mouth or the throat.
And I'm assuming you are at greater risk if you have an alcohol use disorder where you're drinking a lot of alcohol plus smoking. Like it's a cumulative risk of
Absolutely.
the two of them together. Yeah.
And we do see that patients who have HPV associated cancers, which traditionally perform much better. They have a much better prognosis. So the 5-year prognosis for HPV associated cancers is double that of the head and neck cancers that are caused by drinking and smoking.
Okay.
So in patients who have an HPV associated cancer and they smoke and drink, their overall prognosis decreases.
Mhm. Yeah, I was just going to ask any other prognostic factors to take into consider, men versus women.
Yeah, so we do see with, like we mentioned before, with those sexual practices, we see mostly HPV is in male patients who are between the ages of 40 to about 65. So we do see that there tends to be a prevalence, a sexual prevalence as well. And in general, head and neck cancers tend to affect men more heavily than women. And we think that that's just because of some of the social practices associated with drinking and smoking in those populations also.
I think I'm out of questions.
Well, I want to thank you so much, Dr. Wooten, for joining us. Oh, can you tell people where they can find you, please?
Oh, where they can find me?
Yeah.
Um, well, I work at a hospital in Buffalo. I work at Roswell Cancer Institute. So if you have issues or concerns or questions, you can certainly come by and see me there.
Wonderful. We hope you found this information informative and enlightening and empowering. Please subscribe to our podcast on YouTube
Mhm.
and like us on Instagram and share with everyone you know. Again, this information shared with Healing with Her is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions that you may have regarding your health. The views expressed by the hosts and their guests are their own and do not necessarily reflect those of the institutions, reflect those of their institutions or employers. Thank you.